Chronically Me. I'm Nicole. Go ahead and hit the subscribe button down below and the little bell to make sure you get notifications whenever I upload a new video. So today's video, I've had a couple of people ask me to do a video on ketamine, specifically ketamine. So I know quite a bit about it. I've been getting it since 2009 was my first ketamine treatment, and I still get them to this day. So let's get into it, I guess. Most people want to know how it works. So the way ketamine works, and I'm really going to minimize the explanation because it can get very scientific, very long. So basically the way it works is the ketamine binds to your pain receptors. So when you go to sleep and the ketamine is working on these pain receptors, when you wake up, it's out of this world when you wake up. It really is almost magical if you think about it. You have hallucinations, you have delusions, even with propofol, which is an anesthesia medication that they give you sometimes. You can still have heavily hallucinated dreams. So I prefer to have my treatments with a propofol. I don't like the dissociative state that it puts me in. Some people really like it. I know it's really good at low doses for depression patients, but I used to get 1,000 milligrams over 4 hours. My dog's back. But now my physician has upped it to 1,400 milligrams over 4 hours. Now my cocktail's a little different than some other people might have. In my IV bag, I have Versed to help with hallucinations, propofol to help with hallucinations and to put me to sleep, the 1,400 milligrams of ketamine, and they also add magnesium to my bag, which helps the ketamine bind to the receptors that it needs to, and then Phenergan for nausea, sometimes Zofran depending. But right before any treatment I get a dose of fentanyl. They give me a dose of fentanyl, and they give me a dose of Versed. So then when I wake up, they also give me a dose of fentanyl because I have severe rebound pain when I wake up from my treatments for some odd reason. I've always had them. So they give me a dose of fentanyl when I wake up. They give me more nausea meds when I wake up. Sometimes they give me Toradol if I have a headache. But that's the all-around treatment plan for me. When I'm there, what they originally do when I first get there is they will access my port. I do have a port because I have no more vein access, so I will insert a video of that right now. You only have one pain patient a day?
Yeah. Your sight is like awesome.
These are pretty good.
Shall we say hello?
He's recording it, but he's not a needle person, so.
Uh-oh. Uh-oh, no fainting.
Mm-hmm. Okay, now that you've seen the port being accessed, which we couldn't really get an up close, it's a very sterile procedure when they do it. As you see, I'm wearing a mask, the nurse is wearing a mask, and I even believe Justin behind the camera was wearing a mask at this point. I'm not sure, I think so. So over the 4-hour period when they start the IV drip or bolus, whatever they call it, you're constantly monitored by a nurse. The doctor comes in obviously and checks on you, but the nurse is always in your room checking your blood pressure, checking like all your vital signs, They do put O2 on, oxygen they put on you, and they just make sure that you don't need anything medicinally while you're under your infusion. Now, my office only sees one pain patient a day, because we need way more observation than the normal patient would. The rest of the patients that he takes are depression patients or PTSD. His office does not accept insurance, but they will give you a super bill at the end where you can make a claim with your insurance company, and they can possibly reimburse you depending. Now, I have Aetna, and I've gone to Cleveland Clinic before for ketamine treatment, and Aetna covered 100% of my treatment. Right now, my treatments are $700 a day. So it gets a bit pricey. However, the office does work with me if I really, really need them to. They're amazing people. They really are. Now, so back to the ketamine. When you wake up, you are going to want to have somebody that you trust and that is a great support system for you. You're going to want that person with you at all times, because you're going to be in and out of it. And sometimes ketamine can make people very emotional, as you know, with propofol can too, anesthesia can as well. So when you wake up, you're going to be a bit disoriented. Well, maybe more than a bit. Right now, for me, it's a bit, because I'm kind of used to the ketamine at this point. But you're going to want somebody close to you that you know and trust. So I'm going to show you a little clip of what it looks like when I come out of it, and then we'll come back. Just because I'm awake.
Finally awake.
Yeah.
How was it?
I had dreams. A lot of dreams.
How you feeling?
Okay. Can't keep my eyes focused. Everything looks like a cartoon. Okay, so that was me coming out of ketamine. Bit hazy, very goofy. I couldn't focus my eyes. And Justin didn't catch this on film, but I remember specifically telling him, I remember which day it was because I did 3 days over a period of 2 weeks. But I remember waking up at one point telling him that everything tasted brown. Yeah. Tasted brown is what I said. So, but in my mind, it made sense. You know, Star can't make up her mind. In my mind, it made sense. With the ketamine, everything looks very cartoony, very plasticky. It can taste like colors, I guess. I don't know. But that's exactly what was going through my mind at that moment when I was talking to him. You're going to have a ride home, obviously, with all the medication that they give you. I know different doctors have different protocols, so you're going to want to check to see what their protocol is. Now, if the dosage seems very low, make sure you reach out to somebody or try to find a protocol on one of the Facebook groups, because the lower dosages are generally held for the mental health patients, the depression and PTSD and anxiety. Like I said, I get 1,400 milligrams over 4 hours now. And that's another thing you're going to want to look for is the longevity of your treatment. So you're going to want to ride. So they can drive you obviously home. You're not going to be able to drive. Trust me, you will not be able to drive. I've known a couple people that when they wake up, they're very in it. They're like, oh, I'm fine. You know, like you can barely tell they had ketamine. there's no way in heck they could drive. Just, they couldn't. So that's my ketamine story. I hope it helps somebody, and I hope you guys enjoy the video. If you have anything else you want me to do or research or look up, just let me know and I'll do the best that I can. So for now, I'm going to say goodbye and I will see you next time.